They're going to be using the wireless mics, but it's the same level.
That sounds good.
Yeah, that's actually good. Whose birthday? It was her 25th birthday. I didn't realize she was that old.
Yes, she is. She made it to 25. I can remember when I was 25, that's when I went crazy.
No, you were born insane.
Every year.
Celebrating the 27th anniversary of my 25th birthday soon. You know, my biggest concern is that I applied for it in August and I still haven't gotten my Medicare Part A card. And like, my birthday's tomorrow.
Thank you. I believe some of you folks met her the last press conference that we had. She came up after the press asked questions. She's probably the most informed person about all of these things outside of our experts. You know, we're going to miss her, and it's unfortunate. You know, 2 days ago I spoke to her in the hospital, and what she wanted to talk to me about while she was laying there was this issue. So it is deeply felt by the people here in Newark. Andrea is a resident of the city of Newark. She lives in an affected area of the city of Newark in the West Ward. She obviously was in bad health as well. I live in the city of Newark. I live in an affected area. My mother lives in the city of Newark. She lives in an affected area of the city as well. So we take this seriously, and sometimes we get a little upset and emotional when people use the issues that we are having in our city to further, whether they're professional goals or personal goals or journalistic goals. We get a little upset, and sometimes we get a little emotional around those things. So today, we really wanted to stick to the facts of what happened. We believe that, you know, out of all of this, the facts started to get thrown aside for conjecture and, back and forth So we wanted to go back to the facts of what actually happened, what's going on in the city of Newark, so that we can set the record straight on a few things and make it clear that the city of Newark has always been in compliance with the DEP and the EPA lead and copper rule in the city. We have never been told that we weren't. In fact, we've done everything they said and above and beyond what they said. So how did we get here? There's a group called NRDC that came and, well, let's go back. In 2016, the city of Newark and Newark Public Schools, I believe, found issues of lead in the water. We had a press conference immediately thereafter, the next day, and most of you were here at that press conference, even those people who are saying that we didn't say it. We were at the press conference and we talked about lead service lines and pipes. In fact, it resulted in two things. It resulted in, well, many things. It resulted in the DEP requesting that the city does more testing. It resulted in a bond ordinance that was passed yesterday where the residents of the state of New Jersey voted to use bond money to improve the infrastructure of pipes throughout the state of New Jersey based on the things that we've done here in the city of Newark. It also resulted in, soon thereafter, us engaging the state of New Jersey around changing our lead service lines. We later got, and I don't want to go over the complete timeline because I know that Kareem is going to do that, and I'm going to introduce some other people that are going to talk as well, or here to support us. The minute we received an exceedance, we receive exceedances. There is we immediately respond in terms of what the DEP asks us to do. We sent out to all ratepayers a notification of the exceedance of lead. We also sent out a press release. As a result of that press release and that notice, and us on Water Watch's website of all of our exceedances that go up there, people nationally found out about that. One of those organizations was NRDC. They came to the city, they approached us. They said they wanted us to sign an MOU with them. The MOU would, in essence, give them the authority to tell the city how to manage and treat or oversight in terms of our water and other issues that we had. Andrea, as the director, Kareem, the mayor, everybody else here thought that that was not correct, that we should not give an outside agency, by the way, who we do not know, that came from California, the opportunity to manage or to tell us what we need to do or not do as it relates to our water. In fact, we have a regulatory agency. That regulatory agency is called the New Jersey Department of Environmental Protection, and the other one is called the EPA, the National EPA, and they have provided sufficient oversight, and we've done everything. In fact, we've done more than they asked us to do. As a result of us not agreeing to sign this MOU, they decided to take us to court to force us to sign the MOU. And in that process, it behooves them to create the scenario that A, Newark is not doing what they're supposed to do, and B, that the DEP is compromised in some way because their relationship with the city and is not, in fact, giving us proper instruction and authority of how to deal with, treat, and manage issues that we have. We disagree with that completely and wholeheartedly, which is why we're in court fighting it, and we believe that, and the DEP also believes that we were in complete compliance with everything that they asked us to do. We continued to test, and immediately, as we found that there was a problem after a firm was hired that we'll talk about, after we sent pipes to the EPA, they verified a few things for us. We immediately sprang into action. We gave out filters, 20,000 of our own we purchased, 20,000 from Pure. They given to us. That was not a recommendation from the DEP. It was a recommendation from our firm who said that we should do that. The DEP wanted us to do something else. We went above and beyond what the DEP requested us to do, and we began giving out filters to residents that were affected in our city. And at the same time, continue to engage the state about replacing our lead service lines in the city, which we're going to do. I do want to say a few things that have been said that's incorrect. So some people are saying that the East Ward is the only part of the city that's not affected. That's not true. It's not only the East Ward, but it's also parts of the North parts of the South, and parts of the Central that's being served by the Wanacue system. There's also another system that we have called the Pequannock system, and those that are affected by that, where our corrosion control inhibitor ceased to be effective, affects the entire West Ward, parts of the South, parts of the North, parts of the Central, and none of the East. That's factual. We are in the process of replacing or changing our corrosion control inhibitor so that it may work. It takes time for it to begin to optimize, which is why filters are necessary until that happens. This is what we're doing. All over the country, this lead service line is a problem because of old infrastructure. It would take trillions of dollars to get this fixed nationally. In Newark, we are doing it. We're not being forced to do it. There was no consent decree. We didn't go to court. Nobody beat us to do it. We decided to do this on our own. We decided to engage the state on our own. In fact, we did it under the Chris Christie administration, who approved us to begin to make this happen. And so we're going to continue to do that. We're going to get through this problem. We believe that we have the information that's necessary. We believe we have the science that's necessary. We have the protocols that's necessary to get us through this issue and make sure that our water is safe to drink in areas, in households that are affected with lead service lines. I do want to say, in closing, that most of our residents in the city do not have lead service lines. I saw or read a report in the Times where they went to an apartment building and asked people about lead service lines. This is why this is important for us to get the right information out to the news media, because apartment buildings do not have lead service lines. And to go there and say that creates hysteria and panic in communities and people who are not even affected by this crisis. It's important that we get the right information out to all of the people. So the airport calls me. So the business community downtown, the Prudential Arena calls me and says, oh, none of these people have lead service lines. None of them. And so it's extremely important that we get the right information out to the residents, to our businesses, to people who commute here, who work here, so that they know what's going on in our city every single day. That is important. Somebody even said when I was on WNYC that did we not do anything because we were afraid Amazon wasn't going to come to the city. It took everything in me not to return to, I was 19 years old on Clinton Avenue. Because, you know, I took extreme offense to that I would jeopardize my health, my children's health, my mother's health, people in this community's health for a business deal. That is the most cynical and absurd thing that I ever heard in my life. And it makes it necessary for us to have this kind of discussion that we're having with you so that we can get the facts out. Today we have Dr. Wade with us, who is Director of the Department of Health and Community Wellness, who's been doing an awesome job communicating with the health department, state health department, reaching out to the pediatricians and other folks in our community, who's been running a serious lead abatement and lead testing program because of lead in our homes, not in our water. We have Kareem Adeem here, who is the Assistant Director of Water and Sewer, who unfortunately, as of today, has a lot more responsibility as we get through this. We have Mark Tompek, who is the water practice leader of McDonald International Engineering Firm with the expertise in water system. Carol Rigo is here, Vice President, CDM Smith, the engineering firm that did the actual corrosion control study that we're talking about, that we're alluding to. Kim Gaddy is here, a longtime advocate in our community, New Jersey Environmental Justice Coordinator for Clean Water Action, National Environmental Justice Organization that organizes grassroots campaigns around local environmental issues. We have our own activists in our own community who've been giving us hell for a long time. We didn't need other folks to come in and take their place. Michael Furry, former chair of American Water Works Association of New Jersey. They will be teaming with us on the outreach that we're doing in our community. We also have Jerry Noddy here, who's our licensed operator for our treatment plant, Newark Water Treatment Plant. He's the licensed operator here for us today. At this point, I want to turn it over to Kareem so you can go over some of the timeline and some of the other technical things that I can't say properly.
Thank you, Mayor. Good morning. Kareem Adeem, Assistant Director, Department of Water and Sewer. In early 2016, April of 2016, the Newark Public Schools reported that they were having a lead crisis. So we had a press conference here. Immediately in August of 2016, the New Jersey DEP required large water systems to revisit how they were doing lead sampling, right? They revised your protocol. City of Newark submitted a plan in January of 2017 that was accepted, and we moved forward in our plan of doing more monitoring and then increasing the number of households we monitor, tier ones. Around April of 2017, being that we were engaging with this DEP, the city began to aggressively seek them to replace lead service lines. And we were informed that the lead service line in the city of Newark is owned by the homeowner, and the governor Christie had put a program, he put $30 million in the program to replace lead service lines throughout the state. Unfortunately, Newark can apply for the program, but we had to get an amendment, which later on happened in 2018, for us to spend public money on private property. July of 2017, we received our first notice of violation in 20 years since we had put the corrosion inhibitor in. In 1997, we put the corrosion inhibitor in, the sodium silicate in the Pequannock system. So just to go back, the EPA in 1991 required all systems in the United States of America to conduct a study and introduce some type of inhibitor of how they would control lead from leaching into the water system. But 1994, we submitted our study. In 1997, we implemented that study, along with the North Jersey District, Wanacue side, implementing their study. Moving forward, when July, immediately after we got our first violation, we started conducting an internal audit of our system in the Pequannock to see if anything we've done recently that may have changed the results that may have led to the lead exceedance level. Towards November, as we looked at the numbers from the new testing going into the second half of 2017, we started engaging in a variety of different engineering firms to come on board to do a comprehensive independent study. Maybe we weren't looking at things they would look at. By January of 2018, we had our next violation. Let me go back. So when we got I'm sorry, my apologies. So when we first got our first violation in August of 2017, we immediately, like the mayor was telling you, did a press conference and issued a press release, and we issued out a public notice. We conducted town hall meetings, public meetings, occupied a block. We went on to those meetings notifying the public of the lead exceedance. We also did a mailer to notify all the ratepayers and residents of Newark, in the entire city, not just in the Pequannock system. We conducted a teletown halls also. So when January came, we had a next exceedance. We immediately had CDM Smith was on board at that time. February, we went down and met with the NJDEP. In February of 2018, we rolled out our plan and the steps moving forward to conduct the study. And also, we reached out to the US EPA, asking them, can we send them pipe coupons of lead service, so they can put under the microscope and look at this pipe. We didn't want to just do a quick fix. We wanted to know what was really going on into the system. It was a little aggressive, an aggressive study than what everyone else was doing. Along that time, we also were still doing the public notice. We did another mailing, informing the community that we had a second exceedance, and we continued to do, we had a press release. We continued to send public education material out to the public. We also continued to conduct town hall meetings and teletown hall meetings. So in late March of 2018, we sent 3 lead service line coupons that we excavated from different areas around the city. We sent it out to the US EPA. At that time, CDM was still doing their internal audit. We were still moving forward. And early 2018, the legislature passed the lead service line replacement bill for the money to be used. We continue to go back and forth with the NJDEP on Newark getting a large share of that money, moving forward with conducting the lead service line replacement. In April of 2018, we actually rolled out the program. Right here, if you see on the board, it says the City of Newark lead service line replacement. We started sending mailings out, contacting residents, letting residents know that they can sign up for this program, and we're 90% principal forgiveness that we were told that we would get. In June of 2018, the City of Newark passed a bond ordinance for $75 million, right, to replace lead service lines in the City of Newark. In August of 2018, the governor signed the amendment to let us use public money on private property to replace these lines. Around the same time, Newark received their third violation, right? Third violation for lead exceedance. At that time, we were still aggressively into the middle of our study. We're doing the study. It's not a 3-day study. It's a comprehensive study to find out what's going on. In late September, we reached out to EPA. They were already starting to examine the pipe. They were giving us some preliminary results. They asked us to do some other type of testing while they finished the results. We did substantial profiling of lead service lines throughout the city locations. That's when you draw water from inside the house. You measure the lead service line from the main, the distance into the house, and how long it would take to reach the faucet, the fresh water coming in off the city's water main. At the same time, throughout this whole time, the city conducted sampling all around the city with their source water to ensure the source water that was coming from the treatment plant didn't contain lead. Throughout this whole period from July 2017 to present, we're still doing that. Source water shows any signs of lead. So in October of 2012, early October, we received the draft copy, 2018, the draft copy, October 2018, we received the draft copy of our corrosion study. And immediately, after we reviewed it with our consultant, we sprung into action and notified NJDEP. And like the mayor said, they wanted us to do something else. We wanted to go above and beyond the approach that NJDEP wanted us to do. And they accepted it. And currently, that's where we're at this stage. So we have a three-point approach to correcting this lead service line. Lead exceedance. One was to immediately put out the filters with a year's supply that will reduce the lead in those homes that's affected by the lead. Two was to introduce a new corrosion inhibitor, currently the same corrosion inhibitor that we're using in the Wanacue system. And the Wanacue system supplies water to Bayonne, Harrison, Kearney, and many other towns around here that doesn't have a lead exceedance. The third step would be to replace the lead service line. We rolled out, like I said, in April of 2018, we rolled out 10 phases over 8 years to replace 15 to 18,000 lead service lines throughout the city. And we continually, through this 1-year period or 15-month period, to offer free testing and free inspections at no cost during the whole time. We also offered free inspections before we even had the exceedance. And that's what brings us to the current step where we're at now.
Good morning. My name is Dr. Mark Wade. I'm the Director of the Department of Health and Community Wellness for the City of Newark. The issue that has been discussed thus far is about the potential for lead in the water of homes that have lead service lines. It's important for us, which is under the auspices of the Department of Health, is to not let us, our residents, or you forget that by far the largest source of increased lead in children is a result of children eating lead-based paint chips. That's been a problem for decades, and we in the city of Newark have been addressing that problem. We have the largest lead testing and home abatement program in the state, supported by the state. And again, we've been doing this for decades. We continue to do it now, and am currently working myself directly with the Commissioner of Health for the state and our respective teams to increase the notification and education of our pediatric providers as well as our community residents to have their children tested. Because lead does have the potential of negative health effect on humans, particularly small children under the age of 6, and most particularly unborn children with pregnant women and children in infancy, 1, 2, and 3 years of age, because lead's impact is on developing organ systems, especially the brain. One cannot look at a child and say if the individual is lead burdened or not. Many children show no immediate effects, but because of long-term potential effects on the brain, it can result in symptomatology such as learning difficulties, hyperactivity, and then growth development, etc. So what we are doing simultaneous to addressing the potential for lead in the water issue is to rally our community to have their children, particularly under the age of 6, and pregnant women to be tested for lead. Providers, if they have them, will provide that testing, and if they don't, they can come to the Newark Department of Health. We provide lead testing free of charge, Monday through Friday, 8:30 in the morning to 4:30 in the evening. Again, it is free. The testing is very simple. It starts with a finger stick. From that drop of blood, we get an immediate result. If the level is higher than 5, we immediately draw a sample from the vein, send it to the laboratory, and within a few days, we get that result back. If that level concurs, greater than 5, then we assign a public health nurse to that family and send a lead tester to their home to test the home for lead to see if that's the source of lead. If indeed that home has elevated lead or lead present at all, that family is engaged to have their home abated or de-leaded, if you will. And if they qualify, that program can be free of charge to our residents. So again, this from A to Z, from suspicion to education to testing to evaluating the home to de-leading the home, that's the work that we've done for decades and continue to do. And again, want to make sure that everyone keeps into perspective a potential in the water from the major cause of elevated lead levels in children, which is ingestion of lead paints, lead on surfaces in the dirt. Kids play, they don't wash their hands, they put their hands in their mouth. And this is the much larger lead issue that, again, in collaboration with the State Department of Health, we are aggressively attacking for our citizens.
Thank you. So at this point, we'll open the floor up for questions. Yes, sir.
Mayor, a couple questions. One, the estimate is 15,000 to 18,000, I just heard,
Right.
Homes with these lead service lines. What percentage of homes has the city been able to test through your free testing program or whatever else that would give you an idea of possibly a total number throughout the city? In other words, on your block, for example, your home may have been tested and found to have a lead service line, but was every house on your block tested? That sort of thing.
So the percentage, we don't test to find out if you have a lead service line. We actually come out and perform an inspection. And we've been actively, with our public education since 2017, letting residents know that they can call us, reach out to us to perform those tests for free, right? However, we need to have access to their basement to perform the test. So we have our records that show that you may have had a lead service or your service mileage may have changed. But however, the city of Newark is a heavy renters. We have about 50% rental population? 70% rental population. So although we may come out, you may want a test or an inspection for your lead service line, the difficulty is if you're not the owner, we can't get in the basement.
Okay. So 70%, then that, there's still a
Actually
big
higher than that.
unknown, in other words, in Newark as to how many homes actually might have a lead service line. Would that be a fair summation?
In 1953, January of 1953, the city of Newark banned homeowners that built new houses, or if you had a leak, they required you to replace your lead service line with copper. So, the,
Over half a century.
right. So from 53 to present, any new home or any home that may have had a water leak, you were required to replace it with a piece of copper.
So, for example, in the Ironbound, where there was a huge explosion of housing about 10 years or so ago, all of that new housing would not have lead.
No, all that new housing would be copper pipe, you're correct.
And then for the doctor, I had a question, please. As far as the free testing of children that you have done over these past months and year or so, how many of them have elevated levels of lead that you have then gone to the house and determined that it may have been from the water as opposed to paint chips, for example?
Okay. Once we get an elevated level in a child and we go to the home, we're testing the home. We're not testing the water. That's done by the water department. Okay. Interesting to note, though, of the thousands of kids that we test, we have about 500 that have elevated lead levels. Okay. And when we go to their homes, we're finding actually a very low level of homes that actually have lead as the source, very low level, about 5%.
So they're getting it from somewhere else?
It's still the highest lead paint chips, but given with the homes that we test, only about 5% of them are turning up to be with elevated lead, therefore requiring us to intervene in terms of de-leading their home.
Do we have any idea where they're getting it from?
Again, because lead is everywhere,
Oh.
children play in the
Visiting
dirt.
a friend, anything?
Well, again, dirt is high, okay? Other surfaces that have leads, we're in an industrial city,
Right.
from fumes, et cetera. So there obviously are other sources, but again, if you look at the highest source is lead-based.
Can I?
Well, it's just one follow-up, if I can, Anthony. I know. I'm like Jim Acosta.
She's next, though, by the way.
I just wanted to know,
Yeah.
though, of that 5%, did you test the water in those homes, or did somebody test the water in those homes?
Well, the health department doesn't test water.
Did
The
some-
water and sewer department test for water. They test water when there's a request to come in and test water. In the past, when there was no need to test the water because there was no exceedance to test water during those time periods, right, that you're talking about. We've had this lead paint problem for 30, 40, 50 years. We had no exceedance until last year, right? So for them to test the paint in people's houses and test their house and then automatically make an assumption to test the water is not logical, since we had no exceedance of lead during those time periods. In the present sense, that's what we're doing now. We're testing the water and the house, exactly why the health department is asking us to make sure we contact pediatricians and the WIC program and allow people to test their children for lead. So all of these things are happening simultaneously now. 2 years ago, there was no need to test the water because we had no exceedance of lead in the water 2 years ago.
Mayor, can you walk us through the timeline for replacing these lead service pipes and the cost?
Well, ultimately, the cost is going to be upwards to $70 million or more dollars is what it's going to cost the city to replace these lead service lines. Where we are now is we are back and forth with the local finance board around the loan forgiveness part of it, which is how much are we going to allow the residents to have to pay in return for us replacing their lead service lines. Remember, this is a private property, and there is going to be some discussion, not just in Newark, but statewide. I think because of the schools, we cause statewide policy, and I think because of this lead service line replacement program is going to cause more statewide discussion because we're using public money to fix private homes. The money is not infinite, and the state is struggling with us back and forth around how much money that they're willing to forgive the residents for once we fix their lines. He's next, then you.
All right. I mean, so you said 70% of the housing in Newark is renter housing.
More than that, yep.
So when you talk about that, there's always issues with dealing with landlords. So are now you
Absolutely.
going to enforce the landlords to let you in to start testing? Is there something that can be done there so you can get into those properties?
Well, that's a community question that we have at every town hall meeting that we have. We are allowing people to pick up filters for apartments if the homeowner doesn't come. And we didn't do that initially, but we're allowing people to pick up filters on their own. If they, can prove that they live in a house, we're giving them a filter. We are contacting all of the landlords, and prayerfully, they've been responsive because it's free, right? We're not asking them to pay us anything, so they have been responsive. If we get into a situation where landlords are not responsive, then we're gonna have to take legal action to be able to get on their property. Again, this is, Western democracy and capitalism. We can't just walk on people's property, but the court can give us the permission to do that for public safety reasons. Yes, ma'am.
Okay, so
I'm sorry, next.
walk me through this if you can. So let's say a parent brings a child down for the free lead test. They have the blood draw and they go in for being punished. They come back with elevated levels of lead. The health department then goes in and inspects the home. Am I correct so far?
Well, it doesn't have to happen in that order, but yes,
But-
that can happen that way.
So let's say, hypothetically, the house does not have elevated levels of lead, and we're left with the question of where does the child pick it up? The only other place, as a parent, I know that my kids spend as much time at home is either A, at school, or B, at a babysitter's house. So my question is, have the schools, A, been tested, and is there a way that if the surface of the house tests negative for lead contamination, is there then an automatic trigger to test the water line?
Now, yes. Before, it was not necessary, as I spoke about. But in Newark, there are other places. People are not just at the babysitter. They can't afford the babysitter, so they might be in other places, after-school program. They might be in the playground or the park, other kind of places where they can contact lead. But yes.
Have those places where the kids spend the majority of their time been tested?
Right, the schools have been tested. We've tested the schools. The schools have their own protocols, but they've been tested. We've helped test the schools. And they were the first people that were affected by this in 2016, which triggered all of the action in the city and all of the action in the state because of lead in schools through fixtures, actually, in the schools, and in some instances through pipes.
Mayor?
I'm sorry.
Thank you so much for reporting to that, by the way. I'm a reporter for ICC. I would love to know when exactly you personally found out that thousands of households in the city might have elevated levels of lead, and I have a follow-up to that.
Well, when we got the draft report, when I received the draft report, then we knew it was a serious problem.
So that means what, October?
It means October of this year, yes. That when we received the draft. That's when I first found out it was a widespread problem, yes. We found out that we had some exceedances in 2017 when we tested over 100 or so sources, and maybe 12 or 13 came back with some elevated levels of lead. We immediately, because of the DEP's requirement, we immediately sent out not just a press release, but we had to send out to all ratepayers notification that there was an exceedance of lead in the water, not just to the affected homes, but we had to send it to everybody. So we couldn't send it to 12 people's places that we found this at. We had to send it to everybody, right? And we continued the message. Andrea did a teletown hall. She talked about it extensively. Then it happened again, so we had to send it out again, right? And that's what happened. And once we got a full report that this is not an anomaly, right, that it isn't just 13, 14, 20 homes that are affected by this, is nothing in their house. It might be the lead service line itself. We began to go right into what it is that we thought we should do the minute we found out it was a widespread problem.
So let me ask you this, because I've heard from a number of residents that have been, that there were robocalls and
Right.
what have you over the last few months, saying that the water was safe.
Right.
You didn't have all the information?
No, we had the information, and we still say that. So we weren't saying that the water coming out of your tap was safe. That's not what the robocall said. It didn't say that because I said the robocall. It never said that. It said the source water is fine. That's exactly what it said. And that's exactly, no, it's factual because after that, not at all, because after that, we explain what the problem is. It's misleading to tell people that the water is contaminating. That's misleading because what it does, it puts people in panic and fear to be able to sell something, right? At the end of the day, your source water is fine, and that's what people had a question about. Is there something wrong with our reservoir, with our source water? No, there's nothing wrong with the source water. If you have a lead service line or lead solder or something of lead in your house, then, right, there is a problem. And this is something that we've been saying for years. This is not a new message. We've been saying it when the city had the school issue. We've been saying the same message. I sat right here, Matt, and said that message, that the source water is fine. The lead service lines is a problem. During the entire campaign, I was saying the lead service lines are a problem. That's why we went to the state to get our lead service lines replaced. And it's important for us because our source water is important to the city. And there's always a struggle for people to pull our source water from us so it can be managed by another person, so it can have oversight by other people, to make it seem like we can't manage our own resources. And I reject that. And I want to make sure that I reject that completely and wholly to let people know that not only is our source water fine, it's some of the best water we have. The problem is the infrastructure. And when water gets into an infrastructure where the lead seeps into your water, then it becomes an issue.
So what is your reaction when people say that the source of the issue, yes, has to do with the lead service lines, but also has to do with the corrosion material, the anti-corrosive inhibitor that you were using, that apparently was not working in one of the treatment plants? Isn't that also a very important part of this problem?
Sure, we say that. That's part of the messaging. We didn't take none of that out of the messaging. Maybe we should send you the robocall so you can listen to it. Yeah, I'm going to say, give us your number. We're going to send you the robocall. Yes.
Mayor?
Back here first. Back here. I'm sorry. You're next. You're next. No, right here.
All right, thank you. I wanted to go over the study you had presented really quickly. So it showed that there were some samples that came up in 2015 showing elevated levels of lead. So did Newark alert the DEP at that time? And why wasn't there then action such as testing or anything being done?
So you said 2015? 2015, anybody that exceeds the 15 parts per billion, they're immediately notified, and the DEP is immediately notified. You had a couple of samples, I think maybe 3 or 4 during that time that exceeded the 15 parts per billion. It didn't, but the city of Newark wasn't in violation for the total amount of samples that exceeded the 15 parts per billion. But that resident was notified and of the homeowner that we took the sample and the proper steps that they needed to take to reduce exposure to lead at that time.
One quick follow-up, because the DEP showed its October results today, and it showed that roughly half of the samples that were tested, October results I'm referring to, still were above the 15 parts per billion benchmark. So what are your thoughts on those results, and what do you think that means for a potential timeframe for eventually meeting compliance?
Well, there will be. That's what the studies told you, that the current corrosion inhibitor that's still approved as an effective treatment on the US EPA's lead and copper rule, sodium silicate is losing its effectiveness. So it will be. That's why we gave out the filters. That's the reason they're springing it into action. That is an immediate step into reducing exposure to lead, giving out the filters with the year-long replacement of cartridges until we introduce the new inhibitor.
So this is a question for Mayor Baraka and Dr. Wade. Correct me if I'm wrong, but from what I know about increased levels of lead in brain development, it can cause increased irritability, hyperactivity, like you said, mental dullness, hallucinations in cases. What are the social implications and repercussions of this in an urban area like Newark and in Newark public schools, if there are any, and especially long term? But really, I guess the medical part is for Dr. Wade and the social.
Well, firstly, the key is testing to know where you are, okay? And The elevated levels, if you will, okay, right now are above 5, okay? A year ago, actually a little less than a year ago, the state reduced the level from 10 to 5. So now we're testing children and calling it an elevated level where that level 2 years ago was considered within the normal range, okay? We don't know what an individual child's response to lead is going to be. You can have a level of 35 and have no response, and you can have a level of 8 and have a significant response. That's an individual variation. So the message, social message to the community is to take advantage of all the resources available, okay? We educate them. We encourage them to have their child tested, or a pregnant woman to be tested by your OBGYN or your pediatric provider. And again, if you can't afford it, you can come to the Department of Health. Or if you just want to come to us, because that's what we do, we're the largest program in the state, come, we do it for free, it's available, and we'll follow through on all the steps that we outline. So the social message is, there's no reason to panic, okay? We have plenty of testing available, and if you fall within the normal range, okay, you're good. Be tested again next year, okay? If you're above, that still doesn't mean, if your level is 7 or 13, it doesn't mean that you're going to have brain damage. It means that it's higher than the level that has been described, okay? So we continue to monitor you in all of your settings, your pediatrician, your teacher, your parents, to see if there's any abnormality or some signal that we need to intervene in some way. So again, it's more a message of reassurance, comfort, and work with us as we work with you.
In school, you're right. I mean, there's issues of concentration, issues of retention of information, hyperactivity, and it can cause, social issues that we have in our community, in our city, and probably has contributed to a lot of issues that we have for a very, 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 very long time. Amongst other things in the city of Newark, that's water has become this sexy thing that everybody wants to talk about, but poverty has been in our community since we got up here. And at the end of the day, the homes that people live in, the neighborhoods that they live in, high industrial neighborhoods, homes that have been painted with lead-based paint, dust that's in and around their community, is ways people ingest lead and inhale lead every single day in our community, which is why environmental justice in these communities is important, which is why we take this seriously in terms of what we're doing and how to address it.
Mayor.
Who's that? Yell my name. Thank you. Whatever, you. All right, I got you. Yes, ma'am.
Thank you.
They first.
I had a few questions about the CDM Smith report because I looked it over. And I just wanted to know who specifically goes out, and I have a two-part question. Who specifically goes out when the state requires testing, on a regular basis? Who goes out and conducts that testing? Is it the state or the city, or is it customers that do it?
So actually, the law for the lead and copper rule requires the city to go out to the customer, perform an inspection to see what type of pipe they may have, educate them on how to do the sample, and you leave a bottle there, and you give them instructions on the bottle, and they're supposed to follow the instructions, and we pick up the bottle, and we send it to our Cedar Grove lab or one of our outside labs.
So, because there was a question in the study that, the reason that Newark didn't catch on to this quickly enough and didn't realize how widespread it was sooner was that testing wasn't, possibly being done correctly. Now that we kind of see that, the lead is an issue too, statistically speaking, to get a better sense of the issue, is the city going to start doing more testing, especially in the Eastward, because the Eastward did have, a test result that showed high levels of lead. So to get a better picture of this, are we going to, do more testing?
So the city is currently doing more testing, a lot of testing, probably overwhelmed with testing. We reached out to a couple of other water purveyors to assist us in the testing, and a couple of other private firms, labs, to conduct the testing. However, the rule requires that the water be stagnant from 4 to 6 hours, and you're to take that first draw sample early in the morning, you're relying on the customer. That's the federal rule, federal and state rule. The East Ward, so let me just tell you about the East Ward with the sample that was high that everybody keeps them out. The water that goes in the East Ward from the Wanacue system feeds half of North Jersey. Half of North Jersey, not just Newark, half of North Jersey. We had a former employee that used to conduct samples that was terminated. He fought us in court. He lost his case. We still had him on the list to give us samples. He spiked the sample. To this day, he's never allowed us to come back into the house to resample it. So that's the 118 Jefferson Street, the property that you're talking about. We know it was a spike sample because previously, if you look in all those results from the report that you're talking about, you'll see it was undetectable levels of lead for the last 12 years.
So, so a resident spiked his own water with lead?
Yes, you could put a lead pencil in the water and get a high lead result. You didn't know that?
I didn't major in chemistry, that's why I'm
Yeah.
asking you.
Yeah, you can put a lead pencil in the water and get a false positive. We know you're going to jump up. Previous testing showed that if we tested you for the last 12 years and it was undetectable, and just one day you jump up to 190 parts per billion, that wouldn't alert you. That would alert us to say, hey, there's a problem over there. We need to go back in there and see what's going on. The employee never let us back in, still to today.
And it was a city employee?
Former city employee that worked for the Water and Sewer Department.
Who was it?
I'm not going to tell you his name. He's still in litigation, but he was a former city employee.
That was good, though. You almost got that one off. I'll give you that.
The address.
That was good.
He gave us the address.
Yeah, he sure did. I was trying to hit him. Yeah, go ahead. Go ahead. Yeah, right. I can't hear you.
Sorry, I was reading through the report, corrosion control study. It wasn't clear when the corrosion control stopped being effective. I don't know if you guys have like a date as to when it stopped being effective. And second, do you know if failures in corrosion control treatment also contributed to the lead in the schools that we found? I know that's old infrastructure, but if it corrodes the water, is that only causing a high level of
She's actually at the report.
when did the treatment stop being effective?
My name is Carol Rigo from CDM Smith. Sorry.
Don't be shy.
Thank you.
Come on out.
A little further to the left.
There's an empty chair, you know, next to there.
Okay, how's that?
Great.
Okay. Carol Rigo from CDM Smith. We're not entirely sure exactly when the treatment became ineffective because it's a slow process. The chemistry that occurs in the pipes in the system is a very slow process. But we suspect it was shortly before the lead results that were detected that Kareem previously talked about in 2017.
Did it cause the schools, the elevated levels in the schools?
That was before that, though.
Yeah, that was before the testing. However, in 2016, we took a lot of samples in the school of the water, and the water didn't come back with lead. And the fixtures, the school did their own thing about their lead fixtures, and they were, if you notice the lead in the school thing, they were doing, it was a lot of different problems. They wasn't changing filters out. They had an aggressive program where they flushed the water, the stagnant water in the schools over the weekend. So there was a lot of steps that they went away from that they wasn't doing to prevent that from happening.
I got you.
So you said, I just want to be clear, you said you found out about the corrosion control problems when that report came out in October?
Yes,
So
absolutely.
what about the lead in the schools? Did you know about that prior to 2016? And if so, who told
No.
you?
We found out about, I don't think there was an issue prior to 2016. We found out about it from the previous superintendent. He called me and said that we did tests, and some of the tests didn't come back good. I called the water department, told them to go over there and test with them. They did that. They communicated to me that there's an issue over here. Some of the places that they tested, that they said had high elevated levels of lead, our water department said did not have high elevated levels of lead, so it was like a confusion back and forth in terms of what the study said. So as a result of that, we had a press conference the next day. We talked about it, and we instructed the schools to shut down all of the places where they thought they had fixtures that were not being used, mop sinks, which was some of them, which were not even water fountains, some old water fountains that hadn't been used for a very long time, but they're still working. So they stopped all of that. They began to put filters or change their filters, and we gave out bottled water until we get a handle on what was actually happening in the school system itself. So that happened in 2016, and I got that information from superintendent of schools and then our water department right after.
But if you look back in the record, you look back at news articles from the past 25 years, the Poison Control Center had expressed concerns about the lead in the water in Newark in both the schools and residentially. How did you not know?
Well, I didn't know. I
Prior to
didn't know prior to that, and I don't know the report you're talking about, so I didn't know. You probably read it, so I didn't read it. Maybe you should give it to me, but I didn't know it then. I found out in 2016 that there was lead, significant levels of lead. We test, the DEP monitors what we test as well. We had no evidence of high levels of lead in the water for 20 years, as far as I know. When we did a corrosion control study, the schools do their own tests, we do our own tests, right? We began to test with them when they called us and said they had a problem, because I asked them to test with them. We're gonna incorporate schools in our testing as we go forward, whether they want us to be involved in that or not. When we found out, we moved forward. I don't get technical reports or engineering reports. I get reports from the water department and the DEP.
And it seems, you mentioned this in your announcement at the press conference, it seems like the comparison between Newark and Flint personally wounds you. Why is that?
Because it's a lie. Not only is it a lie, it kind of, what happened in Flint was egregious. And I know it's sexy, it sells, it's something to put on the front page. That's not what happened in Newark. Flint purposefully did not put the corrosion control inhibitor in their water. Ours stopped working. That's a marked and clear difference of what happened. They had widespread issues where they had boil water advisories for people to boil their water. Newark never had that. We don't have any boil water advisories in our city. They had all kind of other issues. The EPA found that they were not in compliance with the state guidelines or the federal guidelines. We've been always in compliance with the state and federal guidelines in the city of Newark. You might want them to be higher, but we've always been in compliance with those guidelines. And so what they did was purposeful and deliberate, right, to save money. Our corrosion control inhibitor stopped working. I know we want to make it sexier than it is. Ours stopped working. We found out it stopped working, and we did something about it. We didn't stop using it to save money. We didn't change our corrosion control inhibitor. We didn't one day make a decision, you know what, let's change it because we feel like it, or an engineer said this one works better. We've used the same one until it stopped working. And we found out it stopped working from CDM and the federal government.
Even though there's a difference
One
between
second.
Flint and Newark, the end result is
Even though that's not fair.
it's still lead in the water.
It's not,
right?
yeah, but it's an unfair assessment. Why? Because I know it's almost sensational, right? Because when people think of Flint and water, is a few things. So when you look at cities like Newark, poor black and brown cities, you know, it's always this kind of cynicism that there's corruption, mismanagement, somebody did something wrong, and so it's good to push those kind of narratives out. But it's a wrong narrative. That's not what happened here. That's not what it is. Completely not what happened here. What happened in Flint was purposeful and deliberate. What we're doing in Newark, in fact, we began to trying to change our lead service lines, and Flint was forced to, right? We began giving out filters without people demanding that we do that, right? We've been giving this information. It's unfortunate that the press caught on later, you know, because of what, you know, NRDC, but we've been putting this information out for over a year now, right? We've sent out press releases for over a year. We've been having robocalls that people are talking about for over a year. We've been communicating with our residents for over a year now, right? So this is not a secret. Will everybody have known, listen to the robocall? Probably not. Will everybody have come to a town hall meeting? Probably not. Are there some people who did not get a flyer or didn't read a thing that came in their mail? Probably so, right? But unfortunately, we have to go forward and continue to do what we do and continue to get the message out until we make it clear. And you guys are helping us to make sure that the residents are aware of what's happening and they take the steps that's necessary to get their homes fixed.
One more question. 1953, do you know how many percentage of the homes were built, you know, that
I
are
don't know
still around? Is there any way to tell what percentage of homes?
I have no idea
Okay.
of how to answer that. I got you. I'm gonna let some other people ask questions first that didn't answer any questions. 1, 2, you're next.
When did the robocalls go out? First question, when did the robocalls go out?
Well,